Om Sri Sai Ram. I offer my love and gratitude at the lotus feet of our beloved Swami. Dear brothers and sisters, our health series webinar continues with a focus on diabetes, a chronic condition with severe health consequences and one of the largest public health concerns. Today we have Dr. Umesh Dashora, Dr. Meera Gondhia, and Dr. Krishna Radia to address this growing health challenge. Diabetes concerns every family, and we hope that this webinar will raise awareness of this condition and help us to reduce its impact and complications on our families and ourselves. Jai Sai Ram.
Good evening. Welcome to Defeating Diabetes. Thank you very much for joining us. There are three presenters for you this evening. It is my great privilege to welcome Dr. Umesh Dashora, who is an eminent endocrinology specialist at East Sussex Hospital Trust. He has led and published a lot of groundbreaking work in the field of diabetes. He is part of the national team of Association of British Clinical Diabetologists, better known as ABCD. This body decides the future of diabetic care in this country. We also have Dr. Meera Gondhia, who is a GP in London and has a special interest in lifestyle management of chronic diseases. She teaches medical colleagues and lectures and presents to community groups regularly. I am a recently retired GP after a 40-year service in the NHS. I have a special interest in the management of diabetes. This evening, we hope to cover what is diabetes, why is it important to know about diabetes, what is the good news, and more on diet and exercise. I'll now introduce Dr. Umesh Dashora to talk a bit more on the subject.
Hello, everybody. Thank you, Krishna, for such a wonderful introduction. I have been doing diabetes for nearly as long as you, but maybe a few years less than you. So 37 years probably in medicine. So we are starting with what is diabetes? Do you think it as a disease, or do you just think it is a different variation of your body and your metabolism? But actually, it is both. And the body cannot handle carbohydrates when you are suffering from this condition. But at the same time, you are a person with diabetes rather than you are suffering with a disease. And therefore, that is how you should look at it. There is a thermostat for monitoring blood glucose level, and that in the body is faulty. And therefore, what happens is that the glucose level in the body goes high and keeps on going high. So why it is important to know about diabetes? It is because with diabetes, there are more and more people being diagnosed as well as having complications and problems with diabetes. So about 4.7 million people have diabetes, which is nearly 10% of the population. And number of people have more than doubled in the last 20 years. And one person is being diagnosed every 2 minutes. Many of them are Blacks, Asians, and minority ethnic community people. In fact, if you have a family of 6, it is likely that one of them will have diabetes. And if you see it here, they are showing it that person with diabetes. And when it is more, then maybe 2 people will have diabetes out of 6 or 8 people. So it is significantly high number of people. And if you consider a family of 6, then one person in each family, nowadays they are telling, may have diabetes or to that degree. Next slide, please. So we have some good data from NHS, which tells us that about 10 billion are being spent on diabetes. So it's a costly problem. And 1 in 6 people in hospitals also have diabetes. And if you have diabetes, then you are twice as likely to need admission to hospital with some illness or the other. Next slide, please. And why is it important for us to know? Because if you are a person with diabetes, you are at risk of large number of complications. Particularly, as Krishna said, today we are talking about type 2 diabetes, and people with type 2 diabetes are at risk of heart attacks and stroke. Of course, they are also at risk of sight loss due to diabetes, and many of them have got renal failure. About 10,350 people have end-stage kidney failure with diabetes. Of course, the circulation can also get poor in the legs, and therefore they may lose legs and have amputation as well. So it could be a considerable health risk if a person has diabetes. Next slide, please. So every week, there are large number of people who are having these complications. So 169 amputations, 530 heart attacks, 680 strokes, and 2,000 heart failures in people with type 2 diabetes. Next slide, please. And why is it important for us even more than it is important for the rest of the population? Because Indians are 2 to 4 times more likely to develop type 2 diabetes than white people in our context. Of course, it might probably also mean other South Asian communities, but for us, the risk is much higher compared to white background population. Next slide, please. And what could be the reason for it? The reason might lie in our bad genes, or it might be what we eat, or it might be just the fact that we are not able to exercise as much as we used to do before all the acculturization and facilities and transports and money became more abundant. And as a result, physical exercise became less necessary and less done. And therefore, it led to a large number of problems which are related to lifestyle and Western acculturization. Next slide, please.
Well, thank you very much, Umesh, for giving a very nice introduction to diabetes. We will now give you some good news about diabetes, because you've been hearing all the horrible things about what it can do to you and how it can affect you. I'd like you to meet Mr. Dayabai Diabetes. As you can see, he is about 40-ish, sits at a desk all the time, has 3 children, has eats a lot of his favorite foods like jambu and McDonald's with Coke. He's been having some symptoms like being thirsty and tired, and he has noticed that he was passing a lot more water, but he didn't feel unwell in himself at all. But his wife and the rest of the family got quite fed up and pushed him to go and see Dr. Meera Gondhia for a consultation, because they were getting a bit worried about him.
Yes, so his wife, Dayabai's wife, pushed him to come and see us, and we gave him a few tips. You know, we gave him some exercise tips, how to manage his diet. He stopped eating the jambus, reduced the Coke, exercised, and 6 months later, he was transformed into a younger, more energetic, less heavy human being. And he did all of this without medication, and his blood sugar normalized.
His wife was very, very pleased with Dr. Gondhia, and thanked her very much for giving him a new model. So this is the good news for the evening for you. We will now tell you what the secret of defeating diabetes is. We think there are 3 strands to defeating diabetes. Number 1, modifying the diet, and as a result, losing weight. Number 2, increasing the exercise that you take regularly. And number 3, having regular check at your doctors. The excessive consumption of food and the type of food appears to be a large contributory factor to our diabetes. We like feeding people by forcing them to have extra portions when they come to visit us and at festivals. We consider fat babies and children as very healthy people. We also tend to eat a lot of carbohydrate-rich food like rice, potatoes, and wheat. We also add a lot of sugar to all our foods. This especially applies to all the Gujaratis. The next question is the weight. The average height of an Indian man is about 5.5 feet, and the average weight is about 13 stones. With the diet, it should be easy to reduce the weight, and we'll give you some more tips on this one later. The most important thing for us is to modify our diet. And we will get Meera to give you some expert tips on how to do this very efficiently without feeling the pinch.
Okay, so this is a plate, and this is what we recommend that each of your whole day should be split into these different food sources. This doesn't mean you eat all of this in one go. This is over, up to 24 hours. So we'll start in a clockwise manner. So the carbohydrates roughly take up about 38% of your diet. So these are the breads, the potatoes, the rice, the pastas, all those things that you tend to crave. And there are good, better carbohydrates. So always, if you can, switch all the white bread, white pasta, white rice for the browns, the quinoas. There's so many new products out there that are really they're a lot better, and we'll focus a little bit more on carbohydrates on one of the next slides. And then you've got your fruit and vegetables. So the World Health Organization recommends that you have 5 portions of fruit and vegetables per day, and 1 portion is 1 handful. So if you think of 2 small satsumas or a pear, you can think about papaya, raspberries, these sorts of things. And then you've got your vegetables like your spinach. In Gujarati culture, there's so many lovely kind of lilu shaks, so things like dindora, karela. We've got so many, and it's really important to cook these and have a good portion of them, but not overcook them or sort of ensure that they're not too oily, for example. And that should take up about 40% of your total allowance in the day. And then you've got things such as milk and dairy. Now, this is approximately 8% of your daily food source. Now, some of you might be vegan, so you can have your almond milks. There's lots of milk substitutes and dairy substitutes out there. But it's very important to keep up your calcium and vitamin D using your milk and dairy. Then you've got the meat, fish, eggs, beans. So this is the protein, and this is roughly about 12% of the diet. Again, if you're vegetarian or vegan, there's tempeh, tofu, lots of other substitutes out there, your beans, your pulses, your dals, your urad. Again, we're so blessed to have such a rich amount of legumes out there. And actually that's really important as part of your diet. And only 1%, unfortunately, is all the food, the fizzy drinks, the crisps, the sugar, the bel puri, pani puri, mamra, gantia, all of that nasto sticks in that 1%, which should be a very small fraction of what you're having every day. So this is a nice slide to show us a little bit about carbohydrates. So carbohydrates are very complex. Effectively, you've got high GI and low GI foods. So low GI foods they release energy very slowly, and this is really important in diabetes. So low GI foods are things like oats, porridges. They release energy but very slowly. Whether the high GI foods are the naughty, sugary foods that suddenly, you have it, it fills that instant spot, something like a Snickers bar. You feel great straight away, and then suddenly you're hungry again an hour or two later. And this also can affect your insulin levels, because if you're constantly just feeding it sugar and, quite frankly, a bit of rubbish, then often the insulin is going to keep on, being pushed to work a little bit harder. And actually what we should be doing is concentrating on eating foods that release energy really nicely and really slowly. Other examples of these are, some vegetables, like I said, oats, the legumes. You want to go for things like sweet potato over kind of chips or bhaja, those sorts of things. There's always good substitutes for these, and there's lots of information out there to guide us a little bit more.
We are very poor at exercising as an Indian population, and the younger ladies and men are now taking more and more to the keep fit and running and things like that. But our middle-aged people do not do any exercises whatsoever, and in fact that is probably one of the main reasons why we suffer more than other people. I would like Meera to give you some specific instructions about what constitutes an exercise and how long we should do it and how many times per week.
Sure, thank you. So exercise, super important. If we're eating really, really healthily and we're still not exercising, you're going to put on weight. The key to weight loss is putting in less and expending more energy, so that we've got that, the income outcome is controlled a little bit better. So ideally, be active every day if you can. Strengthening activities are really important that work all the major muscles groups. I mean, in the summer, this could be gardening, Pilates, yoga, things like that as well. There's lots of home workouts that are happening now. So a favorite person of mine to watch is Joe Wicks, who many of you may know does home exercises, mostly initially actually for children, but now there's lots of adult exercises on there. They're free. You can get them on YouTube. They're about 20 minutes. And he also does kind of more for targeted at elder patients. So, my nanny ma's doing her Joe Wicks workout, and it's just things like getting up and down off the chair, star jumps, trying to reach for certain areas, picking up heavy books. It's all part of his workout. So that's a really good resource. Ideally 150 minutes or more of moderate intensity exercise over a week. So if you think about it, half an hour a day, 5 days a week, you want to get yourself hot and sweaty. So anything that can do that, if you're going to go for a walk, try and make it uphill. Try and make that a really brisk walk. If you get a bus somewhere, get off maybe a stop or two before and see if you can walk a little bit more. Try to reduce any time lying or sitting down or being sedentary. We know that also reduces your muscle mass as well. And you often find people start to kind of waste a little bit. So being active, it really helps your energy levels, it helps your mind, helps your mood. So it's really important to keep trying. And hopefully when all of this is over, there's lots of things you could do outside. Running, swimming's fantastic for those of you who have joint problems, because you reduce the pressure because you're floating in water. So that's an excellent exercise to do. And break up long periods of sitting. Some of us are working from home at the moment. Keep making a little reminder every half an hour. Get up, stretch your legs, move, bend, see if you can pick something heavy up, sit back down. And again, it's really good for your mind control as well.
So it's not the end of the world if you do have diabetes, and quite a few of us will probably get diabetes. And if you follow some of the principles of prevention, you will be a much healthier person even if you do not have diabetes. The most important thing is to make sure that you pay proper attention to your diet and do exercise regularly. But the last thing that's very important for all the diabetics and people who are suffering with overweight problems, etc., is regular checks at your surgery. All the Asians after the age of about 30 should really have an annual blood sugar check to make sure that they haven't developed diabetes silently. And it is worth attending the doctor's surgery regularly at yearly intervals, at least yearly intervals, to have your weight, your blood pressure, and your blood tests monitored for cholesterol and kidney functions, and also to get your eyes checked regularly once a year to prevent any deterioration and take early action if required. I think that has concluded our slide presentation, and we will be looking at some questions that have come in to us. Questions come through, and I'm going to start off by bunching the most common ones first and addressing them to the right person out of us three. The first few questions are related to why diabetes is such an awful disease that affects all organs of the body. It's a disease of the pancreas. So how come, Dr. Dashora, it affects my kidneys and heart and brain and everything else? Can you explain that a bit more?
So diabetes is essentially high glucose levels, but also in addition, there is a problem with the endothelium, which is lining of the circulation part of every organ. And because that is inherited as well as partly acquired due to the, if you like, poisonous effect of high glucose levels, and because circulation is essential part of all organs, diabetes can cause everything except pregnancy, although that might also change in future.
So how come it bothers the kidneys so much? I mean, what does it do to the kidneys that makes them function poorly in the diabetics?
So kidneys are particularly interesting organ because they are affected with the blood flow as well as the circulation as well as the nerves that supply kidney, and all these important components of the body are affected independently by high glucose levels. And that is why kidney problems, because of the microcirculation being affected, is a considerable complication in people with type 2 diabetes.
And also it does horrible things to the eyes as well. Can you explain what it does to the eyes?
Yeah, so mainly when I'm talking to patients, I tell them that it might affect your eyes, kidneys, feet, and heart. So that's a nice summary of, if you like, a prompt to people. And then they say, yes, yes, I've had a heart attack, or yes, I've had a stroke. And eyes are, because the eye circulation is the one circulation which you can look at by using instrument called ophthalmoscope. So when the eye specialist look in the back of your eye, he is actually looking at the status and the health of the blood vessels throughout the body in real time. And that is why he is able to pick up these changes much earlier before they happen anywhere else. So eye changes are the first one, and they can be the most significant and important one, because if the circulation get compromised, then there will be dryness in the back of eye, then there will be hemorrhages, and sometimes the person can go blind.
I think it's important to mention here that all the diabetics are subjected to an annual check using special cameras, and they look at the back of the eye and the pictures are sent to the specialist. And if they can see any early changes, they're referred very quickly to the ophthalmologist who can sort it out and prevent blindness. And recently, it has been documented that the highest cause of blindness that used to be diabetes in this country has now gone down considerably. So that is another very useful thing to remember for all the diabetics. Dr. Dashora, what does it do to the heart then? Because what has heart blood sugar got to do with heart, and why do they get more problems?
So yeah, again, the same problem, because as I said, it is affecting circulation as well as the glucose as a, if you like, food for the muscle of the heart. So both are affected. Diabetes is like living in an ocean where you cannot drink water because the ocean is not the right kind of water for you. So there is plenty of glucose all around in the body, but it is of no use of any of the organs, because in the absence of insulin or because of resistance to insulin, this glucose, which is the building block or the energy that all the organs need, can't use it because it can't go across the cell membrane. So therefore, we are thirsty in ocean, and all organs are thirsty. In addition, there is more of clotting, and therefore, if the blood supply to heart gets affected, then you get heart attack. So the heart gets affected in multiple ways.
Okay, and the last question about the organs was, what does it do to our brain, and why do we get strokes if you're diabetics more often than normal people?
So again, if you see the same logic flowing, it is the circulation. So if the circulation in the brain also gets affected because of the endothelial, which is the lining of the circulation, as well as the clots in the arteries that go to brain, they get affected. So then you can't get blood in the particular part of brain, and therefore you get a stroke or weakness or paralysis in the more major and ultimate complications in the brain. So, and if it is just low level, then it can affect depression, dementia. So there are various sorts of effects on brain.
Okay, from the brains, I'm going to go to the toes now. How come diabetics have black toes, infected toes, fungal toes, bad nails? How does that happen?
Yeah, so again, as I said, the circulation is one part of it, but also because the nerves, which also for their health depend on the blood supply, and therefore once the nerves also get affected, there will be a damage to nerves to the foot as well as the circulation of the foot, and there might be some muscle weakness between the toes. So muscle, nerve, circulation, everything is affected. So the foot is at risk. And therefore, once it gets an ulcer, then it doesn't heal and it can get infected. The infection is not controlled very well in diabetes. It goes up from foot to leg and can go into the circulation and blood poisoning. And therefore, it can lead to either amputation or death. And therefore, foot is an important place where one should keep an eye and avoid any start of infection. As you mentioned, Krishna, fungal infections or other infections between the toe. So keep the foot dry, keep looking at the underside of the foot. If you can't look it, obviously, you can look in the mirror, or you can ask your partner, because she might enjoy or he might enjoy looking at your foot from the other side. And that way, you might be able to help prevent any complications in foot going further.
The picture that we were showing just now was an elderly man that I saw with a staple stuck in his foot that he didn't know about. The sensation are lost in a lot of diabetics who are poorly controlled and when they get older. How does that happen, and what other sensation problems can the diabetics have?
Yeah, so that brings us nicely, Krishna, to the nerves. And it is the nerves everywhere in the body. They also depend on their circulation on the microvasculature, as we call it, or as small vessels. So because of the effect on them, the nerves also get affected. That is one of the possible explanation. There are other reasons. And once nerves are damaged, the first nerves, or sometimes even before the diagnosis, to get affected will be the longest nerves. So those are the nerves of feet, and therefore they will lose sensations, and that might be the first indication. And many people, even 30 to 50% of people, even before the diagnosis, may have some damage to feet and some loss of sensations. But it doesn't stop there. The nerves of stomach can be affected, so you will feel full earlier, and the food doesn't go down quicker. And also, you cannot maintain your blood pressure when you stand up, because that also depends upon the nerves supplying the blood circulation. So when you stand up, you might feel giddy because the blood pressure can drop considerably, and you might even have a fall. So the nerve effects are important. The nerves of heart can also get affected, and therefore you can get either stoppage of heart or heart becoming irregular. So all sorts of organs which depend upon nerve supply can get affected through the effect of diabetes on nerves.
Diabetes is quite crafty, really, isn't it? It really has a go at the blood vessels, and the blood vessels are required for absolutely everything, every organ of the body, including the skin.
Yeah.
So if it attacks that, then we are in a bit of a trouble, and it's not going to be that easy to defeat it. Then the next question is a lot more straightforward, Dr. Dashora, so it's not a problem at all. How come diabetics have to have very, very tight control on their blood pressure and cholesterol? What does it do to diabetes, and how does it help?
So diabetes is not just a disease of glucose, or let's put it like this, the complications that a person with diabetes will have will not depend only on the glucose, but will depend upon other factors. So what we have found with clinical studies is that if we tackle all the factors together, then there is higher chance of people living longer without complications. So what are these factors? What are these bad things for your body? So high glucose is bad, but we also know high blood pressure is bad because that causes heart attacks and that causes stroke. We also know that high cholesterol is bad because it makes blood thick and the blood cannot flow, and therefore it helps blood glucose in causing heart attacks. So the cholesterol is also bad. And then smoking is bad as well, because smoking people also have higher incidence of heart attack. So you can see now that for a person to have heart attack and stroke, which can actually happen in 50% of people with diabetes, they'll die of heart attack. And therefore, our intention and our interest in people with diabetes is to prevent heart attack and stroke. And to prevent, we need to tackle all these factors and all of them together, including weight. So if you have high weight, then also there is high risk of having heart attack and stroke. So weight, smoking, blood pressure, cholesterol, glucose. And of course, we have talked about the nerve damage. So therefore, feet and eyes and skin. So we look at all of these things, and all of these things are important. And now they are also adding heart failure, because now we have got medications which can help heart failure. So we have to screen, as you said, Krishna and Meera, in your surgery. These are the things that you have to look for and carefully assess so that you can prevent further damage. Lot of eye damage and lot of kidney damage can be nowadays prevented and reversed and in fact cured. And that is why we are more and more interested in people attending these appointments for eyes, as you said, and for leakage of urine in the protein. And these two things will pick up a number of complications which are just about to start, and we can prevent and even reverse these complications.
You forgot to mention, I know a lot of people that we are speaking to don't drink a lot of alcohol, but alcohol is another thing that's worth pointing out is not a very conducive thing for diabetics.
Yeah, alcohol also can increase blood pressure. So alcohol is interesting. It does some good things to good cholesterol, but overall it is bad for you. So you might hear from people, well, wine drinkers or Mediterranean people, or red wine, is it good for me, doctor? Shall I take some? And all that is true. And in fact, in United States, there was a slogan some time ago that drink alcohol and clean your coronaries. So people used to think by drinking alcohol, they will avoid heart attacks. And to some extent, it is based on evidence. But overall, the impact of drinking alcohol is bad because it increases blood pressure, and therefore the overall effect on heart can be bad unless you can stick to a very small moderation. If you have to drink, like 1 or 2 units will be my recommendation.
Is it possible to give some idea of what people would call as not a normal blood pressure, but a target blood pressure for diabetics?
That's an interesting question because no blood pressure is the right blood pressure for every single individual. Internationally, guidelines have struggled to find a blood pressure that would apply and be the right blood pressure for everybody. In general, between 120, the higher blood pressure, and 140, again the higher blood pressure, is the range in which we should keep our people. Below that, it starts becoming bad, and above that also it starts becoming bad. Of course, in certain specific groups, you might have to individualize which blood pressure is right for the person. So as I said, if somebody's blood pressure is dropping significantly when he stands up, then maybe the standing blood pressure may be the right one for that person. Otherwise, he might fall, have a hip fracture when you are trying to reduce blood pressure. Equally, if he has had previous stroke or kidney problem, then 130 systolic is better than 140. So there are some small print stuff in the blood pressure. And although they used to say the lower the better, but now they have realized that the lower the better is not good either for glucose or for blood pressure, and I think even for cholesterol. So there is a right range in which you should have all these things. Of course, weight is similar. Weight is also for Asians is little bit lower recommended than the one that we would read in books. So books might think, you might look at people and say, well, this is normal weight. But actually, if a person has diabetes, he should reduce weight by 15%, and that would be the right weight for that person. So even if you are slim, if you reduce another 15%, you might be able to cure your diabetes in 70% of the people for at least up to 2 years.
And can you give a very brief idea about cholesterol? I know it's difficult to be exact, but what sort of cholesterol level should people be aiming for?
Yeah, so people will get their results from the doctors, and they will discuss among themselves also. So in UK, the levels that we are used to is millimole per liter, and that is 4 and 2 we are aiming for people with diabetes. So what is 4 and 2? So 4 is the total cholesterol, and 2 is the LDL cholesterol, or what is called as bad cholesterol. So that is in general, but in some people you may have all cholesterol, which is good cholesterol, and therefore they might be exempt. So we might have to look at those. And particularly in Indians, the problem is with the triglycerides, as Meera told, that we are used to more carbohydrate diet because it is tasty, isn't it, Krishna? And therefore, high triglycerides is a result. And therefore, triglycerides may also have to be brought down, because there is now good evidence that it is not just the bad cholesterol, which is the LDL cholesterol, but also triglycerides, which we should try and bring down.
Thank you very much, Umesh. We'll give you a little bit of rest just now, and then we'll come back to you. And earlier, we talked about the 2 or 3 things that were very important for us to defeat diabetes. And one of the things that was very important was monitoring as a means of defeating diabetes. It is vitally important. And I'll ask Dr. Meera to talk about the regular checks that you're supposed to have at the surgery and what they involve. It might give you some more idea about how we tackle the end organ damage. Meera, it's over to you now.
Thanks. So Dr. Dashora has been through lots of really vital information, actually. So the way that I like to think about diabetes is how it affects the big vessels and the small vessels. So the big vessels we've covered already, so things like stroke, heart attacks, and you also can get problems with the pulses in the leg, because it's almost like a heart attack of the legs, which is called peripheral vascular disease. So every year we check for your foot pulses. You also have a foot check as well, because like Dr. Dashora said, it can affect the nerves in the feet. You do a blood pressure check, because that lower blood pressure or a well managed blood pressure can reduce your risk of stroke and heart attacks in the future. We'll do a cholesterol check as well. And then you've got the microvascular complications. So the micro are the little vessels, which can affect behind the eye. So every year you should have diabetic retinopathy screening. The The retina is at the back of the eye and it helps you see. So that's very important. Your GP should refer you to have annual eye checks. And in addition to that, you have the foot checks, usually done by the nurse, and the blood tests, which involve your HbA1c. So we've very lightly touched on that. Your HbA1c for the majority of people is how much sugar is attached to your red blood cells over the last 3 months. And that's the test that you often have. And you should have that ideally once a year. For those of you who have diabetes and perhaps not as well controlled, it may be more frequent than that. And the other thing is how it affects the kidneys. So what we recommend is a blood test to check the kidneys, but also a urine sample. So usually it's the earliest urine sample in the morning or any time, to be honest, as long as you give it to your GP. And it measures how leaky the proteins are as well. And that's called your ACR, your albumin creatinine ratio. So all of that together is your general diabetic check. Your annual diabetic check, and it's very important that you attend that. And also, if it's coming up, please get your flu jabs, because that's really important too, because we know, especially with COVID as well, that patients with diabetes are at high risk of complications with COVID, and the flu could potentially help protect you against that.
Thank you very much. And Dr. Dashora, I'm sorry, it's no resting time for you. Do you want to touch briefly on the screening for diabetes? Who should have it, and what are the sort of screening procedures that are relevant?
So screening for diabetes is based on the risk factors. So as you said, if you come from an ethnic background where there is high risk of diabetes, then we test for it. So after 40 years of age. And of course, it is an opportunistic screening as well. So if you've got somebody who is in hospital for other reasons, and that condition, like as I said, foot problem or heart attack or stroke is associated with diabetes, we test for diabetes. In pregnancy, of course, at 7 months, if there is a ethnic population or a previous history or a bigger baby in the previous pregnancies, or a family history, then we test for diabetes in that population. So those are the, we don't have a standardized national screening program for everybody for diabetes, but we have a high risk and opportunistic screening program in the UK. For our population, I think we should all get a test done, as you said, either at an opportunistic stage or after 40, once a year.
It's worth mentioning that ladies who develop diabetes, unfortunately, during pregnancy, quite often reverse it. But as they get older, they're more likely to develop diabetes. So these people have to really watch themselves and be screened regularly. We've just had a question, and I'm not quite sure whether this is worth answering or not, but I'll leave it to you. People want to know about triglycerides and not just cholesterol. And I thought this is too technical. So can you give some general guidelines on that one?
Yeah, I mean, in general, the triglyceride levels it depends upon the lab and they use it. So 2.3 or lower, depending upon the kit that is being used. So it should be in the normal range of the kit that the lab is using. And the lower triglyceride is better. It is associated now. There is much more evidence that the drugs that are used for triglyceride, they might become standard drugs now in future, not just statins for cholesterol, but also the triglycerides may have to be reduced.
Okay, and I think a related question was, obviously steroids and some drugs push up the blood sugars. Can you just mention very quickly which drugs do this, and is that reversible when you take the drugs off, or do we need to?
Yeah, so the steroids are commonly used if you've got breathing trouble, if you've got asthma, if you've got COPD, which is a condition of lung with smoking many years. And of course, you can use, the steroid is useful when a person is on oxygen and is affected with COVID. So with COVID, there are increasing number of now complications with steroid-related high glucose levels. the way it affects is mainly related to high glucose level after food, and therefore sulfonylurea like glycoside might be a good option. Whether they go away after stopping, generally they do, but sometimes steroids might just unmask a person who was going to develop type 2 diabetes, and that group may continue to remain in diabetic range, if you like. Somewhat similar to gestational diabetes, and after delivery about 30 to 40% may develop diabetes at some stage in their life, and therefore it is just something that has precipitated diabetes, which may last longer.
Thank you very much for that. With reference to the eyes, we mentioned the changes at the back of the retina. It is also worth pointing out that people with diabetes develop cataracts a lot more earlier than other people, and you should be on a watch out for that. And also, I would like to point out that your eye checks at the opticians, if you're a diabetic, are free of charge. So please capitalize on that and do have them regularly. The time is marching on, so we want to tackle the last important aspect of our defeating diabetes if we really want to have a good go at it. And that is to do with diet. And lots of questions keep coming about diet. And I thought the best way to answer them would be if I was to say what most gurus eat for food, and then maybe Meera can tweak them and say this is okay and this is not okay. So I'll start off by saying what an average breakfast for a Gujarati person is. We either have a kara parota or batetana parota or puri, and a very nice garam masaledar chai with 2 sugars. Sometimes we add gatia and a few other things and matcha to it as well. Now and at 11 o'clock, we obviously would eat some chevro, semamra or something like that, and maybe have a little drink and a fruit as well. So is that an okay thing to do, Meera, or should we change that?
Oh, my Swami. No. That's terrible. I know we all love it, don't we? It's a carb hit, it's fried, it tastes good. But remember, moment on the lips, lifetime on the hips. So you've got to think about everything that you eat before you pop it in. So I think that there's lots and lots of information out there, and obviously this is very generic advice, but before, when we were talking a little bit about the carbohydrates, we spoke about low and high GI index foods. So things like puri, paratha, what happens is that you get that sudden energy peak, and then it suddenly drops and you're hungry again, and that's why you're having your chevra at 11 o'clock. So the best thing really to do is have slowly released carbohydrates. Things like oats, porridges, you can pop things like flax seeds, chia seeds, fruits inside. You want to really cut out the sugar. There is literally no need for sugar apart from the fact it tastes good. I can't think of any positives for it, to be honest with you, apart from if you're hypoglycemic, where your sugar levels are so low that you need sugar instantly to push it back up. But other than that, try to cut out as much sugar as you can. It also increases the amount of weight that you have. So I guarantee if you cut out sugar and a lot of things like bread, especially the white breads, exactly the pastas, things I've mentioned before, you will see a massive improvement on your physical body, but also your mind as well. So that, other ideas are things like avocados, lots of fresh fruit. I think, Dosha, there's a slide on lower carbohydrate type fruits that we've popped on there previously. Things like lime, melon, star fruit. These ones are really good to have as snacks as well. And this is actually, sorry, Dr. Krishna, I know you're going to tell me a bit about your lunch, but just whilst the slide is on, these are really some good recipe ideas I found on a good Facebook page I use. So there's lots of vegetarian groups out there, but these are just some ideas for lunch. Salads are fantastic. You can make them very protein heavy as well by adding things like quinoa. You can put in different types of beans and lentils and nice dressings, and they're very tasty and filling too. And thank you, there's some lowest carbohydrates in fruit. So these are some of the fruits that we would recommend. Generally, the fruit juices are terrible for you. They really increase your sugar. So it's much better if you can opt for whole fruit, and at least 5 portions of those a day, fruit and vegetables, because they are so much better for you. They're sweet, they give you that nice filling, and you also feel good. When you eat well, you feel better.
So, Dr. Meera and Dr. Dashora, is it okay for me to say that sugar is really a poison and that people should start reducing as much as they can, and we should not worry about the shares in Tate and Lyle, and if possible, have no sugar at all at our home? Is that a reasonable thing to say?
I don't have sugar at home, and I don't know when was the last time I bought sugar. My daughter, of course, as you know, Apurva, she uses stevia, which is a plant substitute or aspartame people use. So sugar essentially is not needed.
So
There
no
was-
sugar in the dal, no sugar in the tea,
Um,
no sugar in Karela Nushak, no sugar anywhere.
I've never understood why Gujaratis put sugar in all their curries anyway, because not all other Indian ethnic groups need sugar for food to be tasty, but the Gujaratis do. And there was this another question about triglycerides, so I found the answer. The level which we like to aim for is 1.7 millimole per liter or 150 milligram %.
Okay, well, we answered that question. And I also want to just plug in for the salt as well to say, try and cut that out a little bit if possible, because that has an effect on blood pressure and things like that. So it's worth bearing that in mind. And now I want to make Dr. Meera's day by saying, what sort of lunch Gujaratis eat. Depending on the size of the rotli that my wife makes, it could be 3 or 4 rotlis and a lot of shak. And dal bhat, obviously, to follow that. And there might be some kerin or ras or some sweet like monta or something like that to go with it as well. And obviously at 4 o'clock, I'll have a snack and biscuit and chai, really. So, Meera, do you think that lunch is reasonable, or should I do something terrible with that lunch?
It sounds like diabetes on your plate. I think what we probably need to do is really try to reduce the amount of rotli. Chapati flour is really not very good for you at all, and also it absorbs, it binds to iron, so you're not able to absorb it so much. Actually, you can use badral millet flour instead to bind your rotlis, or you can have oat flour as well. So that's a possibility. Instead of the white rice, brown rice or quinoa is actually very good as well. Slightly higher concentration of protein and lower GI food, so it will release the energy nice and slowly. And try to pull back on the rotlis. So maybe half the rotlis and have a bit more of the shaks, because we're so, like I said before, so lucky with the types of vegetables we have, the tindora, the turia, the karela, binda, aubergine, everything that we have. Try not to overcook it. Really very little need to put oil. If you invest in a very good non-stick saucepan, I don't even use oil anymore for the non-stick saucepans I have. And obviously excess oil then just turns into fat as well, which you don't need. So there's lots of little things you could do there. Try not to undercook things, have bigger portions of shak if you're hungry, and less of the carbohydrates. And to finish off, you said you have rus. Mangoes are terrible. They so I work in a very big Bengali population in central London. During Ramadan, the sugar levels are so high. We thought, what on earth is causing their sugar levels to peak so much? Because they're fasting, and it's the mangoes. So if you can, try to avoid lots of mangoes. Much better to get some unsweetened yogurt, something like Greek unsweetened yogurt, chuck a couple of blueberries in there, and it will still give you some satisfaction.
One thing I forgot to tell you was, you can give me any diet advice you want, but I mustn't go hungry, I mustn't starve, and the portion shouldn't go down. Now, it's a challenge for you to sort that one out. Can you suggest some things that will change my 4 rotli and my dal bhat?
Trust me, you're not going to starve.
Okay.
You'll get used to it. You have smaller portions, and your body will get used to it. And also, there's lots of supplementary things you can have. Like I said, increase the shak portion, reduce the amount of rotlis, have some nuts. Nuts are really filling. So Brazil nuts, almonds, no salt on top of them though. Yogurts, Like I said, there's so many extra things that you can have. You know, have a little bit of fruit, have a bowl of fruit with it. And really, once you start making these changes, they will be hard at the beginning, but give it, you know, a couple of, sometimes, what's it, a habit is something like 28 days in a row, you start to do the same thing, and you will be so much more thankful for it. You won't have the complications of diabetes, and it's just positive for your mind and your body.
Well, you given me a brilliant idea, because what I can do is I can reduce the roti to 2, and I can double the shak, so the portion is not affected. And I can increase the dal to 1 bigger bowl and bhat to just a few spoonfuls, and then I won't starve. So that's very helpful. And in the evening, I'd have a very light meal. You will be pleased to know this one: khichdi, shak, and kadhi, probably, and maybe a little bit of milk with some sugar in it, just to finish off really.
You're having too much food, Dr. Krishna. Your khichdi is great, actually. It's very good Ayurvedically as well. Maybe have less of the rice and more of the dal when you put it in. You can put lots of vegetables inside khichdi as well. So you can add sweet potato, sweet corn, broccoli, you know, and that's a really good meal in itself. And generally that should be hopefully enough for dinner with a little bit of yogurt on the side. If you have milk before bed, there is absolutely no need to put sugar in your milk before you go to bed at night either. Also, if you have lots of salty and sugary food at night, you get very thirsty, and it can interrupt your sleep as well. And it's so important to have a good sleep cycle too. So there's lots of little things there. And remember, portion control is so important. We all overeat. We all, you know, our eyes are bigger. I'll show you here next to me. I've got mutia that someone's left there. It's so hard, isn't it, that we have so many things that are disposable, but we shouldn't try not to even buy it and bring it into the house, because you can stop things there.
And this is for Dr. Dashora and for you as well. What about the weekend treats with jalebi gatia and meaty rotli and gulab jamun and all that? Is it all right to eat a little bit of that and, you know, exercise and things like that? Or should we really go all out and not eat it?
I mean, occasional treat is allowed. Christmas is coming, but you have to keep it under control.
Okay, and this one is for Dr. Meera, really. The Gujaratis don't do very well on what they used to call something called kathor. You know, the beans and urad and mug and lentils, and those are very, very good, you know, very diabetic friendly foods. We should really look for some recipes to do with that and see if it can be put into breakfast and some of our salads and things like that. Have you got any suggestions?
Yeah, sure. Actually, Dusha, there's a slide there on a stir fry that I found. Again, if you just Google diabetic friendly recipes, or yeah, so this is a really good one of mine. So a sprouted mung bean stir fry. Literally, you know how you get the mug beans with the little tails that look like tadpoles, but they're all vegetarian. You pop them into a salad, a bit of tomato, spinach, lettuce. It's a really good, nutritious meal that you could try. And yeah, like you said, Dr. Krishna, there's so many. There's the split yellow beans, and the pigeon pea, azuki beans, black beans, turtle beans, urad. All of these have so much protein. Again, they are low GI, so slow releasing foods. And you can have that, for example, on the side of one of your sabjis or your curries or your shaks with a little bit of rotli, and actually they're really filling and very nourishing too.
I am very, very sorry we're running out of time, and there are still a few more questions to come. I think maybe we'll have one more session for this one. And I think we will finish on this nice note and say thank you to all the listeners and all the questions that they've provided. And thank you, all of you, for answering the questions in such nice, succinct manner. And hopefully we'll see you again. Thank you very much.
Thank you.
On behalf of Sri Sathya Sai organization, I take this opportunity to thank all our wonderful speakers. And not only it was very informative session, but all the listener will agree with me that it was very interesting. Actually, everybody was thinking that you were on the stage and performing. So not only you are very good speakers, you are very good artists and actors as well. And I think this is the way to reach to the people's brain also and touch their heart also. And I'm sure they will have learned a lot. And I'm sure, as Dr. Radia said, that we must have another session with question and answers, because it is a very challenging problem, not only with the Asians, but other people as well. And our heartful thanks on behalf of Sri Sathya Sai organization and Health Awareness Committee. May God bless you all. Thank you very much.